What do BMD scores and Z-scores mean for osteoporosis? Imagine your bones as a building's foundation. Over time, that foundation can weaken, making the building more vulnerable. Bone mineral density tests help us understand just how strong or fragile that foundation is. When you get a bone mineral density test, the results are often reported as T-scores and Z-scores. These numbers are like statistical reports comparing your bone health to different reference groups, helping doctors decide if you have osteoporosis or are at risk. The T-score compares your bone density to the peak bone density of a healthy young adult of the same sex. Think of it as comparing your bones to a perfect, strong building from when you were at your strongest, around age 30. The score is expressed in standard deviations from this young adult mean. If your T-score is above -1, your bones are considered normal. If it falls between -1 and -2.5, it indicates osteopenia, which is low bone mass but not yet osteoporosis. When the T-score drops to -2.5 or lower, it signals osteoporosis, meaning your bones are significantly weaker and the risk of fractures increases. This score is especially important for diagnosing osteoporosis in postmenopausal women and men over 50 because it relates bone strength to peak bone mass, giving a clear picture of how much bone loss has occurred. The Z-score, on the other hand, compares your bone density to what's typical for people of your age, sex, weight, and background. It's like comparing your building to others of similar size and age. The Z-score is also measured in standard deviations from this age-matched average. A Z-score above -1.5 suggests your bone density is normal for your age. If it's below -1.5, or sometimes -2 depending on guidelines, it indicates your bones are weaker than expected for your age. This can be a sign that something else is causing bone loss, not just aging. Z-scores are especially useful for children, premenopausal women, and men under 50 because they help identify secondary causes of osteoporosis, like certain medical conditions or medications. If your Z-score is low, your healthcare provider might investigate further for underlying issues such as gastrointestinal problems, autoimmune diseases, or kidney issues. Understanding these scores is key because they help determine your fracture risk and guide treatment options. Bone density testing, usually done with a DEXA scan, is recommended for women over 65, women under 65 with risk factors, and sometimes for men with concerns. Remember, these scores are just part of the picture. Your healthcare provider will consider your overall health, history of fractures, and other risk factors before making a diagnosis or recommending treatment. So, in simple terms, T-scores tell you how your bones compare to a young, healthy adult, helping diagnose osteoporosis. Z-scores show how your bones compare to others your age, helping uncover other causes of bone loss. Both are important tools in understanding your bone health and keeping your foundation strong for years to come. Always consult your healthcare professional for personalized advice and interpretation of your results.